When I see the young pregnant woman in my maternity here, in the labor suit, I'm seeing a baby expecting babies. I imagine my 14-year-old who is in school, the one pregnant. And I'm seeing the future of the country is here in this young girl, at risk of dying if I don't do my best. 4 years ago, we had issues to do with skills and knowledge gap of the frontline healthcare workers. 75% of the deaths that we had in the region were attributed to the third delay, mainly knowledge and skills gaps, and then lack of emergency preparedness for the sick mother and her newborn. The challenge of skills gap at the health center 3 level, the basic emergency obstetric care centers for our pregnant women in the sub-region, was a very big gap. And also non-functionality of some of the health center 4s. And the most common emergencies that these women with complications of abortion come with is hemorrhage, excessive bleeding, and infection.
We actually had rising cases of maternal deaths that are related to hemorrhage or blood loss. Yes, from bleeding after delivery to even bleeding before, yes, during labor. In an event that a mother was bleeding and needed to be saved quickly with blood, it became very hard to get this blood 120 kilometers away, say to Pakwach, to save this life. Sometimes you'll find that actually the blood is not even available at that particular time, even when you needed it or when you had the means to go and pick it.
The ANSWER project has greatly supported us in addressing the glaring gaps that we had in maternal and newborn health service delivery. We had interventions of addressing skill and knowledge gap through clinical mentorships and training, BMOC trainings of frontline midwives, because we believe that if the mother receives the best care at the primary facility, birth outcome will definitely be good. We've also been trained at the healthcare facilities to be able to counsel a mother with an unwanted pregnancy. If they come to the facility and they receive the rightful messages with a very positive attitude towards them, we can greatly change the mindset of that mother to even keep the pregnancy. In the whole package of post-abortion care, the first and foremost thing we do is manage the emergency she has come with. If she's bled, she needs blood, we transfuse. If she has infection, we treat. The second one is prevention of recurrent pregnancy of the same sort, family planning counseling. And then the other benefit that we see at regional level under the ANSWER project is the LMNS, the Local Maternity and Newborn System. It is active and coordinated on a daily basis. The platform of LMNS, the clinical mentorship has made us interface with the lower level unit workers. We've also been able to ensure that the health center 4s that were functioning suboptimally are able to deliver their CMOC roles, and most importantly here is cesarean section and blood transfusion.
We felt a lot of the challenge at that time, especially in regards to making blood available, would be addressed if we had this unit here. And UNFPA was actually key in doing this, and the unit was set up. Since that time, the trend in regards to maternal death relating to blood shortages has actually changed significantly.
We have seen the health system strengthened with accountability from all levels of leadership.